Hi, I'm Dr. Jeff. Today I'd like to talk about vaccinations in pets. Firstly, what is a vaccination? It is a medication that we as veterinarians administer to stimulate your pet's immune system so that it will recognise and defend against a killer virus if or when it meets that bug later in life. A safe deactivated portion of the original virus is usually used as part of the vaccine to allow your pet's immune system pre-warning or training so it can be protected against its harmful effects at a later date. Recently, to vaccinate or not to vaccinate has become a big debate. To tackle this question, we must rewind a little bit. I am your veterinarian, your local Green Cross vet is your veterinarian. We have spent a large portion of our lives training to help animals. No one in the world could get me to inject something into your animal that was not protective. Nay, not helpful, or at worst, dangerous to his or her health. Not going to happen. So if I'm the veterinary health professional, I love animals, and you trust me to look after your furry friend, you must trust that I'm going to stay abreast of the latest vaccines, vaccine developments worldwide, and I'm only going to give a vaccine that is helpful to your pet for life. Viruses kill, we see it every day. What do we vaccinate against? Parvo virus, a deadly, debilitating disease that causes its victims to bleed to death. A horrible way to die. Currently we have several live outbreaks in Queensland. Dogs are dying of this disease today. Canine Cough, a nasty preventable upper respiratory tract infection, most dangerous in the very young or very old. Feline flu, feline leukemia, feline infectious peritonitis, feline AIDS, even the names sound nasty. Trust me, you don't want these diseases to have any chance of infecting your pets. The truth is that vaccines are still needed, but sense needs to govern their use. There is strong evidence to suggest that the first 3 juvenile vaccines are all important. They set up the animal's immune system for a lifetime of protection. Boosters are needed, and we at Green Cross will be the first to let you know when international recommendations change from annual to every 3 years. Once we have a vaccine that we know and trust well enough to use in our own mother's beagle every 3 years, our recommendations will change for your beloved pet. In fact, some of our clinicians are trialling a 3-year booster program now. Dr. Google is evil. Don't scare yourself Googling vaccines on the internet. It scared me, and it's what I do for a living. Data is often from very small case studies and focuses on American groups where up to 12 vaccines are mixed and given at once. Overkill. The most given in areas with high virus load in Australia is 3 to 7 virus strains in one effective protective vaccine. We don't get the reactions written of in the US of A. Take it from me. Get a good vet, get a Green Cross vet and ask them about vaccines. Talk long, think long and vaccinate for life. Don't risk it.